Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Wanted to bring you up to date on some developments in Washington. Recently, the Centers for Medicare and Medicaid Services published a proposed rule in what they call the Physician Fee Schedule Rule. And a part of this rule included regulations that essentially lay out the details on a statutory requirement for a face-to-face physician meeting to occur before any kind of durable medical equipment could be provided to a beneficiary, a Medicare beneficiary. There was some question as to whether CMS would extend this same face-to-face physician requirement to orthotics and prosthetics. And of course, the statute itself permits CMS to do so. In fact, the proposed rule, as proposed by CMS, states that they will not go forward and implement at this time the face-to-face physician visit requirement for orthotics and prosthetics. And that's separate from and treats durable medical equipment very differently than O&P. That's a good sign. That's additional evidence that CMS recognizes a real difference in how they regulate DME and O&P. Of course, the O&P Alliance, NAAOP, of which is one of the members, will be submitting comments to CMS regarding this proposed rule and supporting that exemption from the face-to-face physician requirement for O&P. But that raises a whole set of additional issues that the field of orthotics and prosthetics is clearly grappling with across the country. I hear from members of NAAOP and many of the Washington-based organizations within the O&P Alliance are hearing from rank-and-file O&P practices across the country that the physician documentation requirements that are being implemented and enforced by the RACs, the Recovery Audit Contractors, and other Medicare contractors are having a material effect on claims, on denial rates, on overpayment requests by Medicare contractors, and even on the types of devices and component parts that are available to Medicare beneficiaries across the country. This is a major problem. It's obviously something that your Washington-based organizations, including NAAOP, are very focused on, and we're trying to make sure that the federal government understands the concerns that are out there across the field. Just last week, there was a report issued by the DMAC Region A, who conducted an audit in follow-up to a previous audit they had conducted, where originally they found 90% of lower limb prosthetic claims for Medicare patients to be overpayments. And the reason they said they were overpayments was because the physician's documentation in the physician file did not corroborate or was not specific enough with respect to the type of actual prosthetic care that was provided to the individual beneficiary. So even though there was a signed written order and even though there was a fully signed prescription, and there was plenty of other documents in the files that the RACs and the MAC in this instance examined, the fact is that they claimed that these payments for these lower limb prostheses were in error, and they deemed them overpayments. 90% error rate, which is just absurd. This more recent update to the audit by Region A noted that this overpayment rate was closer to 75%, which is still way, way too high. Again, they determined that the reason for this overpayment rate was their examination of the physician's records, which, by the way, as you well know, are not even within the control of the prosthetist. And they determined that the physician's records were not nearly detailed enough and did not corroborate the care that was actually provided to the patient recommended by the prosthetist. So this is obviously a major problem. It continues to be a problem. It's something that your Washington organizations, including NAAOP, are working very hard to try to get turned around and to try to figure out how it is that we can make sure that O&P practitioners get paid by Medicare for the care that they provide to beneficiaries, and that beneficiaries have access to the types of technologies that are going to be most functional for them and meet their needs. Thanks so much, and we'll talk with you the next time we do a webcast.